All right, and you can see that's a typical treatment in our office is when the patient come in is we sit down and we do a consultation with them. We learn about their history of the present illness, and then how long, what they come in here for, how long they have the problem, and have they tried anything else. So it's basically typical with most medical office, chiropractic office. But then beside that, we do the examinations, and then we actually take picture of the posture, because many people know they have bad posture, but nobody actually ever seen it. And they say seeing is believing. I have a case where the patient was get treatment for about 3 months, but after the whole treatment's done, she told me, Dr. Tran, if it wasn't for those pictures, I would never actually follow through with the treatment plan that you present to me, because I never thought I looked that bad. So we do little pictures of the posture of the body of the patient before and after treatment. So we show them the difference, and that actually register and let them know that it is bad, because we always in denial. We all have this problem for years. We always know that it's there, but it's always in our back burner because we don't think it's a big deal. It is a big deal. Your central nervous system is everything. Everybody worried about spinal injury, paralysis, and brain stroke, all that. Well, your brain is useless if it cannot communicate with your body. And the only way they can communicate is your spine. You use your spine every single second of the day. But how often do you ever think about taking care of it? You know, you go to the dentist every 6 months, we have our blood check once a year. Well, what about your spine? When was the last time you had your spine checked by anybody? And I don't care if you believe in chiropractic or not, we good at what we do because that's what we do. So whether you believe in us or not, give us a chance, give your spine a chance. That's why it's so important to make sure we take the pictures before and after, show the patient what's wrong. And then we start with treatment with cupping and acupuncture to tenderize your meat, or in another term, we make your muscle softer. We take out the trash in the muscle, the lactic acid build up from muscle overuse. That's what damages the muscle. That's what destroys the muscle. And when the muscle's tight, it's killing the joint. They lock everything off. They put tremendous amount of wear and tear on it. Most of the joint problem we have right now is we did it to ourselves. Usually when you think about trauma, you think about car accidents, fall, sport injury. But you know how often you get those injuries. But you know, like this guy, all day, every day. And we're getting worse and worse every day. You see people do this all the time, right? Who's holding your neck up? The muscle. So if you don't address the muscle, nothing changes. That's why some of you just said chiropractic fail. Yes, if we don't tenderize the meat, we don't lose up the muscle, we can't move the joint. We forcefully do it, but then go right back. So that's why we address the muscle first by using acupuncture, cupping, and then we do the chiropractic adjustment. And it is a necessity. It's like a main course right there. You have appetizer, you have dessert. But the main course is chiropractic adjustment, because it doesn't matter how much I tenderize the joint, the muscle, if we don't move the joint itself doesn't get treated. So we treat the muscle, we treat the fascia, we treat the tendon, and then we move the joint. Now, after all that, then we do the physical rehab. Rehab meaning restore your normal function. But if you don't have the normal range of motion, you can't move as far because of pain, because of restriction, because of tightness. How do you restore function? So that's why in Optimal Chiro-Rehab Center, we have step by step, and we lay that out in front of you. And you decide, and you understand, and you let us know this is what I want to do. Because it's all about, you know, educating guests, right? Nobody knows exactly what's going on with everybody, all diseases. But if we give you enough information, you can make the correct choice by yourself. And in the long term, you might see us a couple of months, but the rest of the next 30, 40, 50 years, who take care of you? You are. We can't do it without you. It's your body. You have to be responsible for it. But we want to make sure you are equipped with the right tool and the knowledge to take care of yourself. We all want to live longer, right? Start now. You can't live longer if everything's broke. So the sooner you take care of it and start it to take care of it, the more you have. People ask me all the time, Dr. Tran, so I start maintaining. You cannot maintain something when it's already broke, right? You can only maintain when it still works well and healthy. So take yourself in, have somebody check your alignment, and see if you need new tire. Well, just kidding. Sadly, we have no new tire. But make sure we have the good alignment so that whatever, you know, condition of your joint is, we still make it last for this longest. We optimize your joint. We optimize your body. Everybody have different genetic, everybody have different weaknesses, right? But whatever you do, the best, take care of yourself, the longer they last. That's all. We have one and only one body and one life. My job is to restore your antique. Yes, they're antique. They might be 20, 30 years old, but the way we use them now, you put maybe 200, 300,000 miles within 20 years, right? It's not how long you live, it's how much trash you put into your joint in those years. And with the spine and the way we use them like that, you triple, quadruple them every day. 1 or 2 hours of sitting and slouching is 3-4 hour wear and tear. So you might be 20 years old, but your joint might be 60. You don't believe it, check online, go on some fitness test, you see what they said about, it's not the biological age, it's how much wear and tear you put on your body throughout those joints. So I hope this helps, and if this make a difference, you think we can make a difference, come in. If you're not sure if we can make a difference, give yourself a chance. What do you have to lose? We do free consultation, we don't bite, we just talk. All right, see you soon.